Good afternoon, everyone. It's great to welcome you all of here this Sunday afternoon, and as well welcome to all the online audience all around the world. My name is Stefan German. I'm the CEO of Fondation Botnar, who is together with the World Health Summit hosting today's session on a critical topic, human rights in the age of AI and digital health. I would like to sort of just reflect a short moment on some of the key drivers that has brought us here at this point of time. And hopefully you will feel the same sense of urgency that we are addressing some of these critical areas around human rights and equity in the context of AI and digital health. The COVID pandemic has accelerated tremendously the global transformation within the digital health and AI sort of technologies. Over the past year, we have seen a response to the global current public health crisis and the enormous quick uptake of new technologies, digital tools, ranging from epidemiological surveillance, contact tracing, even vaccine development, and as well sort of the diagnostic set in many, many countries. But the pandemic is only accelerating a trend that has already been underway for many, many years before. But we've seen in some countries that some of the regulations and laws were rapidly changed in a way that we have thought might take a decade otherwise. There are many governments and international organizations and private actors who have seen that digital health is probably one of the most critical drivers of transformation for us to achieve the Sustainable Development Goal 3 and especially universal health coverage. WHO maintains, for example, that the use and scale of digital health solutions can revolutionize how people worldwide achieve higher standard of health and access services to promote and protect their health and well-being. Yet I think we should not be mistaken. Whilst there is on one hand a tremendous upside of the opportunities of these technologies and advances, without human rights safeguards, comprehensive governance mechanism, especially around data governance, and inclusive public consultations, these technologies in the digital space and AI can quickly turn into significant danger to human rights in health and health equity. This panel this afternoon investigates how AI and digital health technologies can be leveraged without undermining human rights. And I must say, I'm really stunned by the panel that was willing to actually get here together. Some of them are here with me on stage, and I'll make a quick introduction, but we have as well a great panel online. The first one I would like to introduce is Agnes Callamard. She is the new Secretary General of Amnesty International, only started a couple of months ago. Before joining Amnesty International in March, as a French national, she has built a highly distinct career in international human rights, working across NGOs, academia, and the United Nations. She was in the past the UN independent human rights expert and special rapporteur. She was as well the director of the Global Freedom of Expression project at Columbia University. And she is an expert and has led many human rights investigations in more than 30 countries, specifically focusing around women's rights, freedom of expression, and methodology of human rights investigations. Welcome, Agnes. Then it's with great pleasure to welcome as well Peggy Hicks. She's the director of the Thematic Engagement, Special Procedures and the Right to Development Division of the UN Office of the High Commissioner on Human Rights. Since January 2016, Peggy started to serve in that role at the Office of the Human Rights Commission. She provides their strategic direction to the UN Rights Office or Human Rights Office to work on a broad range of pressing human rights issues, including human rights in the digital age and expanding civic space. Before that, she was the Global Advocacy Director at Human Rights Watch, where she was responsible to lead a global team in advocacy around all the world. Then we have as well here on stage, we have Gregory Moore, or Greg. He's the Corporate Vice President at Microsoft Health and Life Science based in the US. And he has one of the unique combination that he brings together both an engineering, but as well a practicing neuroradiologist and a neuroscientist. And he's an innovator who has a great ambition and a personal passion, as I've learned, to really leverage and transform healthcare for the benefit of humankind. He currently leads the entire effort of Microsoft's health, including AI and machine learning technology for healthcare and life science. He's part of the Microsoft senior executive team that really leads all the strategic partnerships within this domain. Then that leads actually to one of Greg's partners is Novartis. They have a partnership around the AI and sort of machine learning. And very welcome to John Olwal. I hope I got your name right. He's the global head of digital ethics and risk and compliance at Novartis Pharmaceutical. John is very passionate about technology, and he has more than 15 years experience as a leader, consultant, auditor, and subject matter expert in technology governance, risk audits, ethics, and compliance. And within that, his primary tasks currently at Novartis are to advise executive and leaders on how to enable responsible, ethical, trusted AI. Then we have as well here a good friend of mine, Nanjira Zambuli. She is the president and co-chair of the Transform Health Coalition. She's as well a researcher, policy analyst, and strategist. And quite importantly, she is as well one of the commissioners of the forthcoming commission that's between the Lancet and Financial Times on governing healthy futures. That's going to be released tomorrow. So maybe you're giving us a non-breaking embargo sneak preview of some of the key findings. As well, in recognition of all her work as sort of an activist, Nanjira has been named by New Africans magazine as among the 100 most influential Africans. The BBC has taken her up as one of the most inspiring 100 influential women in 2019. And more recently, she has been rated in another publication in Africa as one of the 30 most influential women in tech in Africa in 2020. So I must say, we have a fantastic panel together, and I would like to really start us off now. And I start with you, Greg. Since the outbreak of the corona's sort of pandemic, which impacted all sectors tremendously around the world, we've seen a massive sort of digital transformation, data-driven technological changes than we have ever seen before. And many people argue that this is just sort of the beginning of a major transformation. Could you describe to us sort of what you consider some of the most significant changes and transformations in the past 2 years in the health sector? And how will this change healthcare in the future from your perspective? First, personally, as that, you know, being a physician, expert and an engineer, but then as well from a Microsoft perspective.
Certainly. And before I start, thanks, Stefan, for bringing us all here together. It's just such a pleasure to be here in Berlin in person at the World Health Summit for those of us who are able to come, and just delighted to be here with you all today. You know, I agree that this, it's safe to say that no industry has been transformed in the last 2 years like healthcare as dramatically as happened. It's been a remarkable transformation to see as a physician, as a technologist, what's happened. And I think what's most remarkable is the speed and the scale which that transformation has happened, and leaning in with technologies, whether that's cloud or AI or virtual. I've seen governments come together just to facilitate collaboration by helping remove barriers to that as well. So it's been both private and public sector coming together to enable this transformation at a speed that, frankly, I never imagined. I think most of us never imagined would happen in healthcare, which frankly has been a laggard in using technology among other industries. From a pure technology perspective, there's 3 significant trends that I've seen that have really enabled this transformation. The first has been this incredible, I'll say, historic shift to the cloud. It's been amazing how the cloud has been used to leverage to and needed to ingest this incredible influx of biomedical data that's happened in the last 2 years, and that could only have happened with the cloud. And as that data came in, the need to facilitate collaboration, not only in a regional, but on a truly global scale among researchers to actually produce the change that we saw, has just been incredible to see. And then that has allowed then machine learning and advanced analytics then to be applied to that data to facilitate that change. So number one's been this incredible shift, a historic shift to the cloud that I've didn't anticipate happening this quickly, but has been facilitated. Number two, from telehealth to remote monitoring, virtual care has really transformed our domain in ways that we had all hoped for many, many years, but it had only been a very fraction of the domain. But now we've seen very substantial uptake. In fact, in some areas of the world, it's gone from a fraction of percentage to over 50% of all encounters. And so virtual care is here and is persisting even throughout as we go forward. And that gives me a great deal and a sense of optimism that now this can be used to actually improve access to care and health equities as we go forward. We have to be careful from this because it's also based on technology. So we have to make sure that technology goes along with those virtual care capabilities. But I'm a real optimist now that we can actually use this transformation in virtual care to bring access to those on the planet. And then finally, number three, I think we now have clarity that scientific clarity that AI-driven precision health is the way of the future. Getting the right medicine to the right patient at the right time, taking into account their individual circumstances and variability, is clearly the path forward for healthcare transformation. So those 3 trends, so bringing together cloud, AI, virtual care together to make a difference in health outcomes and improve access, I think is just been incredible to see in that transformation as we go forward. And I think the challenge ahead then is how do we bring all of these together in a substantive way in the domain of ambient intelligence in healthcare, so-called ambient clinical intelligence, to make a meaningful difference for us going forward.
I'll get back to you on some of the last talking point on the ambient sort of intelligence that is really fascinating. But let me turn now to Nanjira. So you are not only the co-chair of this new Transform Health Coalition, which is really sort of a global advocacy effort that really looks at rights-based digital transformation, especially in low and middle income countries. You're, as I mentioned before, you're as well a commissioner on that Lancet FT Commission on Governing Health Futures, which will launch tomorrow, and you can give a small commercial on that session tomorrow. But in terms of going forward from an advocacy and activist perspective, what do you think will be different about health futures in the digital age based on some of the current work that has been done and is going to be released tomorrow?
Thanks, Stefan. And I hope you can hear me okay. Yeah, I think the simplistic answer is more tech will be part of the health futures, right? Question being whether that's better, and that is TBD in a sense. But everybody knows that the pandemic has really helped push that forward. Everything from contact tracing apps, however successful or not they were, to AI models being deployed to do an analysis of data. And as Greg has pointed out, I think my country, I'm just surprised at how much cloud adoption had to have happened so quickly after years of waiting and making the case. And now it's a reality pushed forth by this. So there's going to be a lot more of that. And I guess we're entering a paradigm where we think about digital health futures post-COVID, because the decade has sort of been marked by that moment. That said, we have to be very careful with the narratives that drive these health futures and the role of digital in there. One narrative we obviously have to be very careful about is the techno-solutionism that every problem's fix is in some sort of technology. What all too often, and maybe not as enough in the health sector, but definitely in other sectors, we've seen that this narrative has led to very expensive mistakes. And I think a sector like health that is so contingent on trust, we have to be very careful about when and how, and the models and assumptions that drive the push or adoption for more technology. So there are potential and pitfalls, really, and that's how we need to think about this narrative. All too often, we're put in this paradigm, you're either an optimist or a pessimist, but it's somewhere in between there that the reality lies. We have all these analog and digital realities that will determine how successful digital technologies will be in advancing healthcare and us achieving universal healthcare by 2030. And let me give one analogy for that. One big metric that we have even in the Sustainable Development Goals was advancing ICTs towards the least developed countries by 2030. And by 2020, we knew we would miss this mark. So if that's an enabler whose mark for affordability, availability, and universality has been missed, we have to be very careful about how we calibrate our understanding on how those technologies that facilitate connectivity and access will serve in our health futures. The other narrative here we must be very careful about, and you hear a lot about, is leapfrogging. This idea, especially that low and middle income countries can leapfrog into this digital utopia where health has all these ideas, is served in the way we imagine. Now that narrative may work in very narrow contexts, and there are very interesting limited set of factors that have to be enabled for that to happen. So leapfrogging can work if you're talking about bypassing legacy infrastructure like old electricity cable type elements for internet connectivity. But it's not going to work for a setting where a viable vicinity or infrastructure to actually access healthcare is unavailable. You can have the fanciest technology brought to that place, but there's so many other determinants of success. Is there reliable electricity, for example, to power that? So we have to be very careful about when and how we think about the leapfrogging narrative so that it can serve us as opposed to creating more divides. So right now where we stand as we go into this decade, health futures will amplify or digital introduction into our health futures will amplify what exists. And it will likely mirror what we know exists in the world, which is a lot of exclusions and inequalities. We have to contend with that and understand that before we map our way forth.
Well, thank you, Nanjira. And I'm turning now to you, John. Yeah, we've sort of heard this whole thing of leapfrogging, and the pandemic has showed it really clearly that there are great global inequalities and gaps. Whereas we here in Berlin, London, Seattle, or Basel might enjoy the sort of benefits of all these new digital technologies and AI in healthcare, we have to sort of recognize that a large part of the global population still does not have kind of the access to these essential, even basic essential health services, as we've just heard from Nanjira. So, where do you see the greatest potential for applying these digital technologies and AI specifically in low and middle income countries? And I remember your CEO has sort of made a commitment for Novartis to have sort of, really try to bring solutions at the same time, everywhere to sort of, that's a big ambition. And how can we ensure that these technological advances help us bring care closer to patients and people in need? Over to you, John.
Thank you very much, Stefan. That's a great question, and I can't agree more with what Nanjira said. We are seeing this divide, and of course, we also see that doing nothing at the moment is not the best solution. So from our side, we think that technology can enable us really to connect far beyond where we are physically. That simply means that if you look at the digital divide, it's exists, and that is a reality. But also we are seeing that digital is penetrating far beyond what physical infrastructure could penetrate in the world. You can see that a kid in Uganda, a kid in Tanzania can have a phone or a smartphone that they can equally get the same level of information that someone in Basel could easily get today. But still there is economic disparities around that. So from that point of view, in our business, we see that we could optimize things like clinical trials, particularly because working with subpopulation communities that were unreachable prior to the upcoming of digital technology is really possible and can be made possible. But this cannot be done by only the pharmaceutical company. It's a tech sort of ecosystem of partnership. And this will involve big tech, it will involve startups, it will involve NGOs, it will involve governments, it will involve even academics as well, institutions, so that we can all come together and be able to do some of those things that we were not able to do before. Because some of the NGOs have deep already access into these communities which are underprivileged compared to how we would have that access as Novartis. So I think we have the opportunity here really to all come together, whether in private sector or in public sector, to be able to help and support the communities using this technology with already existing or non-existing infrastructure. The other area is we are seeing it is very possible now with these smart gadgets to capture social determinants of these communities, which would definitely help us in the planning of the healthcare system of the communities, which if without these smart devices, without this technology, would just be impossible and just prolong that journey. Of course, this is not perfect, but there are opportunities there. In partnership, we can do more and encourage and improve the lives of so many people globally. And lastly, we are also seeing the opportunities which are being brought about by this technology in education and making people aware, even educating the HCPs, healthcare professionals, nurses who are in very, very remote places. We could partner and see a way and find the best way possible on how we can educate them, we can make them aware because of the existence of these technologies. So the underlying word here is that there are a lot of opportunities. Of course, we need to be very careful that these opportunities are not widespread. But with those opportunities, we can really partner together and support the underprivileged communities globally.
Well, thank you very much, John. And I'll share a bit your sort of enthusiasm and optimism, but I think, Nanjira, you're a bit more skeptical, isn't it? And or more pragmatic, because I know you've argued sort of in different places that, you know, there is really a still big issue in terms of the bridging the global digital divide, and even has slowed down in recent years, which we really have to acknowledge. And I think we have to as well acknowledge that the current impact on many low and middle income countries of the economic fallout from COVID will further reduce some of the gains that we have made for the last 2 decades in terms of poverty indicators, which will mean most likely as well, if you're not careful, digital access issues. So can you tell us a little bit more on some of these sort of factors that you feel are really hindering us, and some practical solutions, how you think we should overcome them?
Sure, let's use some scenarios. So we can talk about what lies on the supply side in the sense of what the supply of infrastructure that even enables adoption of digital technologies. As I was saying, we've seen digital development efforts brushing into a country context to bring some new digital fancy technology that's supposed to work in healthcare or something like that. But there's been no analysis whatsoever whether there's electricity, whether there's enough infrastructure around healthcare provision in those communities, or what that looks like, and whether this is the appropriate way to go about it. That's been a huge challenge where you have a fancy solutionism leading to a cart being put before the horse. Then on the demand side, we have ideas of availability of internet infrastructure, affordability, time, who has the time to actually be on their phone based on what the other economic activities even afford them time. And that typically takes a gendered perspective. You also will see that social cultural norms are something that we overlook a lot in this reality. Who can own a device like a mobile phone? Is there a community there that if I'm seen as a woman walking around with something that is my own agency, right, to own a device, is an adverse social cultural norm will impact whether, if the only option to get healthcare is through this device, could be a risk and it could lead to an exclusion. So that's just one scenario to show what's happening. Then we have this other element of what I like to call pilotitis. It takes two forms. A small pilot project is run somewhere and is assumed that it's going to work everywhere. At the same time, a successful one happens and then funding runs out. So those are the little things that also are creating distrust in the systems, because can you imagine if a particular community is subjected to this kind of pilotitis, when is anything going to stick around to actually serve them? And where can we have sustainable sort of like infrastructure supplied towards advancing digital health that even allows them to help us innovate on how better to keep it within the community and sustain it? So because the question is always asked about what are the solutions, the solution is to sit with the trouble a lot longer, to really analyze. And remember, every country context, every community context is unique and diverse. And if we do not take enough time to understand what works and what doesn't, including what kinds of rights-based frameworks are there in that context, we risk creating the same mistakes and ending up, yes, with digital health futures that are vastly, with inequalities. So sit with the trouble a lot longer, understand, analyze as long as possible before jumping towards the innovative solution to apply.
Thank you. Before I go to Peggy and Agnes, I would like to ask you, Greg, we mentioned that you have this sort of, you're a medical doctor, you're an engineer, you have been in leadership positions for big tech companies, currently with Microsoft. And fascinatingly, if I get that right, I think I've seen in your CV that you have as well a degree in theology. And sort of when we listen sometimes to sort of some of the Silicon Valley and West Coast sort of rhetoric, it kind of gives the impression that they're kind of like techno-solutionists or techno-evangelists, sort of believe that almost sort of religious dimensions, that this will sort of all the problems that we face, and sort of slightly naive faith in technology as the silver bullet of all of today's or most of today's problems. But what about some of these underlying major challenges, poverty, gender discrimination, inequality, that if we are not careful, that these advances are just making it even larger, and from a human rights perspective, that's deeply troubling.
Yeah, Stefan, I think there's some truth in what you say, that as it's possible to get so caught up in the technology and the excitement of technology and that innovation to really help and solve problems, and to lean in with that sense of urgency the domain requires, that you, as technologists, you can, and I think I and my colleagues have been guilty of this in the past, of not always recognizing the underlying challenges. Myself, it's why I continue to be a practicing physician, and it's why I also spend a good deal of my time even practicing medicine in villages in underserved parts of the world, to keep me grounded in that it is, as you say, it is core issues of poverty, inequality, gender discrimination, as you talked about, and even in the use of the technology that are real barriers to going forward. And fundamentally, I believe that only understanding those and using developing technology to actually enable those at the front lines of care, rather than replacing those at the front lines in care, is the key to the future. It's also something we've thought about a lot at Microsoft. And it's been part of I think a incredible cultural change over the last decade, to become a learn-it-all company versus a know-it-all company. that brings an appropriate sense of humility, working with partners, saying that you don't understand it all and you will only be able to have a meaningful impact as you understand and bring that together. It's a temptation that even our CEO, Satya Nadella, has said that when you've had a lot of success as a company, you tend to think you've had it all figured out. And by being a learn-it-all company, it gives you that proper sense of humility to lean in with your partner to understand what their needs are. And that's particularly important in this domain as we think about healthcare and life sciences. Having said that, optimists and pessimists have been referred to. I am a technology optimist here, but I also believe that technology really unleashes the power of human ingenuity to help them solve problems and create opportunities at scale to make a meaningful difference here. But we will only do that together in collaboration, as been mentioned, and with one another, not to disrupt healthcare, but actually to positively transform it by bringing technology to the table.
Great, and let's turn now to Peggy, who I understand is sharing a bit your sort of enthusiasm and optimism, and as well sort of for tech. And so I would like to ask you, would you say that the potentials and the benefits of digital technologies and AI, specifically in the context of health and achieving SDGs, really outweigh the risk and dangers that are potentially there? Or would you more agree with the Philip Alston, who is the UN Special Rapporteur on Extreme Poverty and Human Rights, who actually warned gravely against some of these technologies, that they could be what he calls Trojan horses for forces that erode economic and social rights and ultimately even undermine progress towards the SDGs? Instead of actually speeding it up. And I would like to sort of, those in the audience, if you haven't seen the report by Philip Alston called The Digital Welfare State to the UN General Assembly, it's really worth reading. It's one of the better reports that I've ever seen to that topic. So over to you, Peggy.
Thanks so much, Stefan. It's so great to be with all of you today. In my Twitter handle, I actually say I'm both a tech enthusiast and a killjoy. And I've meant to reflect through that same sort of, I feel personally, the same sort of ricocheting between that potentially unjustified techno-optimism that Greg spoke about, and that expects technology to somehow save us all, ricocheting back to the view that we see quite regularly now, that technology and social media in particular is going to be the death of us all. And what we need to, of course, say, and this is a point made earlier, that dichotomy is itself part of the problem. We can't look at this as a question of whether technology will help us. It certainly can, but the question is how we need to act to make sure that it is used in those positive ways that Nanjira and others have spoken about. What it means in practice, I think, is that if we're going to move forward, we absolutely have to access the potential of digital technology in critical fields such as health, but especially because this is a field where life and death is at stake, we have to make sure the proper guardrails are in place. And the problem that we see, and Nanjira's comments also went to this point, is that currently those guardrails are very limited and in many cases non-existent. What we know is that both states and companies need to do much more to put in place the safeguards to ensure that we are reaping the benefits of these technologies while at the same time effectively controlling the risks. And what my office, the UN's Human Rights Office, has talked about is that, from governments, we're really looking for more engagement in this area. We need regulation that focuses on how technologies are being designed, developed, and deployed. And that means looking at them to be more transparent about those processes, more accountable for what happens, to have in place measures that, for example, review and audit how technology is being used, more on the data protection and privacy side, and also, a real attention to the issues of discrimination, which have already come up in this conversation. From companies, what we're looking for is a reliance on the UN guiding principles on business and human rights and putting those into practice. And those principles, which most of the big companies and many of the small ones have said that they do try to abide by, means that they have to do more and to be transparent, as I said, for governments as well, but also that they need to undertake human rights due diligence. And by that, we mean they need to, in advance of using some of these technologies, they need to be willing to assess their impact very specifically, looking at what are the potential human rights risks, who's going to be affected by this technology and how, and make sure that they're mitigating for those risks in the right way. Thanks.
Yeah, thank you, Peggy. And you're bringing up an interesting point that later on in the conversation, I'll pick up with Greg and John on this sort of, human rights due diligence or human rights impact assessment end to end from these, before these technologies are initiated, the research developed and then eventually implemented. So John and Greg, just think about this for a bit later on in the conversation. But I would like to get back to you, Peggy, on actually Philip Alston's report. And you mentioned the importance of more debate. And I think there is clearly, he highlights there's a lack of critical public and governmental debate around these technologies and their human rights implications. And we've seen that there's an interesting court case in the Netherlands where actually Philip Alston was involved in providing an expert input on an AI-enabled system that targeted welfare potential welfare abuses of poor people. Whereas a similar technology was quickly abandoned when it was looking at tax fraud of middle class because they are paying taxes and others. And so the issue of policymakers and citizens really kind of engaging much more sort of what is your take on some of these things and what would you encourage to both governments, civil society actors, but as well big tech companies to consider in that needed space for more dialogue around these issues.
Thanks a lot. No, I think it's a really important point. And on this, I absolutely agree with the concerns and issues that Philip Alston and others have raised. My office does, sometimes sound like the killjoy. We're the ones that are talking about the ways in which some of these technologies are being rolled out in ways that can have a, incredibly adverse impact on human rights. And one of the things that worries us is that these conversations are often phrased in the future tense, like what might happen, what risks are, what might, what harms might occur. But the reality is it is happening today. And we know that. We've seen examples across sectors, including the health sector, where AI, for example, is being used in a way that either because the data set that's relied on builds in discrimination, or the approach that the AI itself is taking is not a well thought through one, where it intensifies and exacerbates existing problems in terms of discrimination. An example is a study that was recently done that looked at how racial bias was brought into US-based health AI systems, where they looked at healthcare costs as a proxy for health, and ultimately concluded that Black patients were healthier than white patients because their healthcare costs were less. Now, you can all look at that and figure out why that's flawed, but the reality is that type of magical thinking has really had an impact on people's lives, and we need to take that up. And in order to have that happen, as you said, part of it is, how do we have the type of conversation we need to? And I think we've all been frustrated at times that the regulatory conversations are skating along the surface, or that it's really, both sides trying to, point the finger at the other. The companies saying, governments, you need to do more, and governments saying it's all the company's fault. And the reality is, to get beyond that, we need, as you said, a better informed and better engaged public. And I think, one of the aspects of this that's developed recently, that's an encouraging one, is the way that sometimes employees within some of these companies are coming forward, and not just as whistleblowers, but in a general sense, to say, we want our companies to do better on these things, and we have the expertise to help them get there. But another thing we really need to think about is whether we have the right institutions. We may need more institutional support, because some of these issues aren't things that your average consumer can take up and engage in an active way. They do need a watchdog organization that can dive into some of the more technological aspects of this and help us evaluate what are the risks from some of what's happening. We have that sort of thing in place for much less sophisticated technologies and things that impact our lives, like food and drugs, but we don't have that same sort of regulatory approach with regards to these technologies that obviously can have a much greater impact. So we both need the public to engage and think about these issues in that way. We need journalists to bring that level of sophistication to the journalism. We need the employees engaged, but we may also need government to help out a bit by creating some institutions that are really going to put these issues into the public domain in a way that gives us the tools to really bring up the concerns that we've all been talking about. Thanks.
Thank you very much, Peggy. And I'm turning now to Agnes, because you mentioned the importance that we might need sort of new institutions in terms of, watch institutions. And, Agnes, you started in March, and then I think your Amnesty Tech team had this sort of involvement in the investigative work linked to Pegasus, where I understand you were even taken to court by some governments, taking Amnesty to court. When it comes to the digital health and AI, what do you consider as the biggest and most severe threats to human rights, and how can we ensure, and what would you advise to, like Greg from Microsoft and academia, but as well governments who are listening onto this call, to sort of, how can we really ensure that these technologies are not undermining human rights?
Thank you very much for giving me the opportunity to speak at this event. I'm not sure I'm going to I'm not going to bring anything particularly new. I think most has already been mentioned. We already know that the technology may bring incredible health outcome, whether it's around DNA editing, gene therapy, genome sequencing, chimeras, 3D printing, and so on and so forth. So we will be tempted to think that there is no need to be worried, and that this may be an example of science just for good, scientific invention just for the good of humanity. But as with all scientific invention, artificial intelligence, when it comes to health, raises fundamental issues, fundamental human rights issues. Just to mention an evident one, the collection, use, analysis, and sharing of health data raises large concerns regarding the right to privacy, particularly as health data is extremely sensitive. Medical device implanted in bodies, such as cardiac device, great invention, but they are increasingly networked, and they provide information and data to third parties. How are those third parties using those data in the short and long term? Looking to the very near future, maybe just around the corner, AI is increasingly focusing on the brain. Elon Musk is developing a Neuralink, which will be the equivalent of a Fitbit in your skull. Kernel is seeking to augment the human brain's ability so that we can decode the brain, and it can evolve with silicon-based machine in powerful way. But as Raphael Just has pointed out, if brainwaves can be read, can be decoded, then ultimately human brains can be reprogrammed. In fact, he's talking increasingly of neural rights, which needs to be developed and are not yet there. I'm not even going to mention machine learning systems and the fact that we don't really know how they produce certain outcome and certain processes, and what could be the implication for health if we don't even understand how they can produce those impacts. So there is currently, as it has been mentioned, no comprehensive international guidance on the use of AI for healthcare in accordance with ethical norms and human rights standards. Even with regard to the many potential benefits of digital health, there are drawbacks, and that too have been highlighted already, which are drawbacks around equitable distribution. I've heard the previous speaker talk about reaching out to the most impoverished and vulnerable population thanks to AI. I will beg to disagree. I mean, I want to be optimistic, but frankly, so far, you know, the evidence will not point to the digital divide being shrank through AI, but rather to the digital divide being increased because of divide. A digital divide between low middle income countries and rich countries, and digital divide within countries. And wait, does that sound familiar? The current inequitable distribution of the COVID vaccine in the name of profit and the protection of the wealthiest countries should be a very good wake-up call as to what happened when the technology is in fact controlled, monopolized by one group of people and one group of countries. And that, you know, the notion that technology could really benefit such certain group of people only is not about science fiction, dear friends, because there are millions of people in the lower income countries right now that are dying just because the vaccine is not being distributed equally. So, you know, we are not talking about imagining here. In fact, I'm neither a positive nor a pessimist. I'm just a factual. I know that there are good things, but frankly, the way it's being used right now, the way health discovery have been used over the last just 1 year, that brings me, you know, not making me feel particularly good about the world I inhabit and being a member of a wealthy country. So where do we go from there to harness the promise of AI for health and ensure it advances and not undermine core human rights standards? I will say that a primary factor, a primary focus for us all must be around global governance and equitable redistribution and sharing of the resources and of the power that comes with that technology. And frankly, given the international system we live in at the moment, I think we, you know, it's a very, it's a rather difficult objective. So if we can't go there, what else can we do? We certainly do something around data protection. I think there is already framework in place, both nationally and internationally. We need to enforce that when it comes to AI and health data. Who is getting access to metadata, collecting data from private individuals so that they probably don't know about, and how is that private data being used? That too must be heavily regulated for the purpose of sharing that information, I think, primarily. Secondly, we need to have very strong safeguards for AI and machine learning. Amnesty International has done some work in that direction with the Toronto Declaration, focusing on one aspect of machine learning, potential effect on equality and non-discrimination. We need to be, you know, focusing on accountability for decision-making when it comes to digital health, and we must be future-focused. We must be future-based because the future is here. The future is right now. We are already behind with the existing development, and it is imperative that whatever we come up with, focus not just on what we know is here, but what we know is happening. We are heading into a period of exponential change, meaning that change which appear modest, but will proceed then at a very rapid rate. In other words, if AI in health and digital health are to benefit humankind, all humankind, then we must be working now urgently and quickly in anticipation of those transformations. Thank you.
Thank you. I would like just to add a little bit here. I mean, we see increasingly that within the health sector, there are very new actors coming in, and we have even like Facebook getting involved in health. We have many others of these large big tech companies. Some of them, more recently, very concerning business models they have been using in terms of large-scale data collection and sharing. Basically, using data extraction and datafication of growing parts of our lives, and concentration of economic and political power in the hands of very few companies. Against this background, how can we hold the private sector accountable, specifically around those who are using business models of data hoarding?
Are you asking me that?
Yeah, I'm asking you, and then I'm getting to John and Greg to hear from them.
All right, well, let me jump in and then others can pursue. Indeed, big companies like Facebook, Google, Microsoft have long had their sight on disrupting the healthcare domain. Why? Because there is huge growth potential and huge profit potential. Last year, Google announced it would be acquiring fitness Fitbit, which would have extended its surveillance-based business model, the nature and the scale of which already represent, in our views, Amnesty views, a systematic threat to human rights. In our view, the deal was particularly troubling, given the sensitive nature of the health data that Fitbit holds, and multiply that, look at it as metadata and what you can do with it. So we wrote to the European Commission to express our concern, and we've had some impact in that the merger was approved, but with binding commitment from Google that Fitbit's users' health and wellness data would not be used, at least not for Google ads, and that this data would be separated from other Google data. That's a small example of an intervention which sought to stop the worst from happening. But frankly, far more need to be done than just writing a letter to the European Commission. We really need a strong governance and oversight mechanisms over those companies. And here too, I'm not optimistic or pessimistic. I just have to look at the fact. We've been bombarded, as Peggy pointed out, with information from various whistleblowers or indeed staff of those companies that have shown that unfortunately the profit is a far more an important objective than preventing harms to users or indeed to society. Frances Hogan, the latest whistleblower, has said to the US Congress that those companies, Facebook, put those profits before people, including around the spread of anti-vaccine misinformation, for instance. So it's so, the crisis right now has been billed as a big tech, big tobacco moment. And I think it's an interesting way of putting it and explaining why it's particularly important that we take the lessons from what's happening now and not be too naive looking at what can we expect from those companies when it comes to digital health and their profit regarding health data. So what do we need? We need transparency in the design and in the use of AI in healthcare. I think Peggy has already highlighted that. We need, it's super important that states disclose where AI systems are used in healthcare, and it's really important that every company that is using AI for health purposes make that information publicly. The due diligence concept has already been brought out, so I'm not going to repeat it, but just to insist that I fully agree with the notion of those companies having an obligation to undertake a human rights due diligence, and then to suggest or recommend strongly that self-regulation won't be enough, and that we need strong oversight and accountability mechanisms. Thank you.
Thank you. And it's interesting you bring up the issue of the tobacco moment, which led then to the International Framework Convention on Tobacco Control. And there has been voices, and I know the Transform Health is looking at this, whether there is need for like a framework convention around health data governance, digital and AI related issues. So I'm turning now to John and then to Greg. What is your take from an industry perspective, listening to Agnes and Peggy sort of, bringing up some of these concerns, and what do you consider are some of the necessary and most needed regulatory steps from an industry perspective, and where do you see is the urgency?
So thanks again for this question. I really appreciate the views from my colleagues. And at Novartis, I can clearly tell you that we are putting human at the center of everything that we are trying to do when it comes to these advanced technologies. We've gone very public to declare that we've defined 8 principles, which are really public, on how we want to go about AI. For instance, we want to empower humanity, which is very, very important to us. We want to be transparent. We want to mitigate bias. And we want to be accountable for anything that we are doing with AI. In addition to that, we are also going to ensure that, if possible, that the environment is protected, because the use of these technologies needs a lot of computing power that is harming actually the environment and eventually also impacting the human rights going forward. So as an organization, we are taking this very, very seriously. And again, I think the best way of resolving these things is to partner, to work together with the non-governmental and governmental organizations, as well as private sectors. The regulations, I think, they are starting to come up, but they are not harmonized globally. As our organizations are clearly stated that we are not going to wait for the regulators to come up with harmonized regulations to help us resolve this problem. So we have started to actually implement AI ethics in the design of our use of AI, and also to ensure that we are going to use that AI only in cases whereby we are empowering humanity. Of course, this is a promise in itself, and this is something that we are working on. We will not be perfect because we are learning as we go by. And when we say by empowering humanity, we are ensuring that in the design of our AI solutions, we have diverse groups, not only tech, not only engineers, but we have journalists, we have people, we want to have people who have different understandings of the subject, not only internal, but also engaging externally, so that we can understand what could be the potential consequence of any of the AI solutions that we are trying to develop. We are also applying technologies to determine if the data sets that we are using are not biased in themselves. Historically, most of this data had been biased, inherently biased, and we are trying to find the best possible way to assess that and not replicate the same errors and the mistakes that we had in the past. We are going to work together with the regulators, including the EU regulators, to ensure that we understand their expectation, and also to understand what is really feasible from the point of, for instance, explainable AI, transparent AI. It's easy to say that, but it could be very challenging and difficult to realize that. And therefore, we need to collaborate, to work together, to enable us to be able to understand what and how can we ensure that the AI is explainable. And also, if we just step back and I understand there is a lot of negative coverage on AI. If you look at the media, there's a lot of negative coverage of AI. But there's also a lot of positive opportunities that AI could really bring to humanity. And if we look at our industry, for instance, there are so much unmet needs when it comes to healthcare. There's so much unmet needs in the discovery of medicine. We are trying to use this technology as well, as much as possible, to ensure that we could meet these unmet needs for those populations or for those communities, which is not necessarily going to harm them. But again, the most important thing, and I think Peggy as well as Agnes have said it, we need governance, we need oversight, and we need to have sure that there are these guardrails. At our organization, we can assure you that we are working on this, and we are not going to use AI in any form of manner that we think is going to harm humanity. And we hold ourselves accountable for that commitment.
Thank you, John. And I'm turning now to Greg. I mean, big tech doesn't really have a great track record when it comes to protecting sort of consumer rights. And, you know, we've seen the Economist, I think, once termed some of these big tech behaviors as the robber barons. And you said yourself somewhere else that big tech really has to earn the trust. And I know that Microsoft and Novartis, among others, have taken explicit human rights commitment rather than just sort of subscribing to ethical voluntary code. Can you tell us a little bit more, you know, how that commitment came about in Microsoft, and actually how do you practically do that in your day-to-day job in your company?
Sure, thanks for the opportunity, and thanks for the comments from my colleagues here, which are really powerful. And it's true that Microsoft has been outspoken in terms of human rights. It really flows from directly from our mission to empower every person in every organization on the planet to achieve more. And our outspoken support and belief in the Universal Human Rights Declaration that every person is born equal and free and with dignity, free and equal with dignity as we go forward. And nothing, as a physician, and I think most in this audience will agree, nothing is more foundational to human dignity than one's health and healthcare. And yet there's 4 billion people on this planet without meaningful access to even basic medical care. I believe this is an area that transcends business. It does for Microsoft. It's an area where certainly Microsoft can do good while we can help do good for the world. I believe that's an opportunity, and I believe that's a responsibility. I think it's also important to say here the role that empathy plays in the development of technology, and especially healthcare technology. By understanding one's needs and living those needs, it really helps us deliver technology in context and also deliver access to that technology and care. And I think that makes us not only better technologists, it makes us better citizens, it makes us better people, and allows us to come together in collaborative ways. We spoke a lot about AI and how AI, and now as AI becomes more relevant and meaningful and more capable in the area of healthcare, agreeing with my colleague from Novartis, it's important that actually industry leads the way here while governments, come alongside with a regulatory structure. At Microsoft, we have a full ethics committee and are leaning in here together with our partners. We believe in the principles of fairness, transparency, reliability, safety, security, inclusivity, which includes equitable access, transparency, and accountability in these areas. And when we undertake an endeavor, and whether it's in healthcare or another industry, we look at these principles as we apply AI in all of these domains. Our CEO said that AI, artificial intelligence, is probably one of one of technology's most significant advances, and that healthcare is perhaps its most urgent need and application. I believe that, and it's those 4 billion people that wake up every day without meaningful access to even basic care that drives a sense of urgency on the teams as we go forward. Finally, I'll say, although we've talked about AI a lot, healthcare is an intensely human endeavor. I believe it should stay that way. And by bringing technology to those providers, whether that's a community care worker in India or somewhere else in the globe, or a frontline provider here in Europe or in the States, it's important that remains a human endeavor and create enabling technology to bring alongside them.
I think you make an important point, and I think it has been sort of stated that AI will not be replacing doctors and healthcare workers, but AI will be replacing doctors and healthcare workers who are not using AI. So it's kind of like that probably in the future. But coming back to, I would like to hear from you, Peggy, you know, as a human rights advocate, in terms of some of the, you know, pledges that companies make to human rights. You know, do you feel that sometimes more cosmetic, sort of washing their business practices, but still potentially harmful? And, you know, if you think it's cosmetic, what would be more needed in terms of more concrete steps? And I'm not at all saying that Microsoft or Novartis are just using that in terms of cosmetic, but we do have, you know, others that sometimes actually are probably in that space.
Great, thanks very much. I wanted to go back to one point before getting directly to that, and that is around this issue of artificial intelligence and innovation as being things that can really make profound differences in some of the most important global challenges. And I think Agnes's example shows this, of course. The vaccine is a huge technological health advance, and we were all so excited when you know, this breakthrough occurred, and it happened in a time frame that, you know, was unprecedented. But if what happens then is that only part of the world has access to it in the relevant time frame, and there's this incredible global disparity in how it's distributed, you know, we do have that case study of the fact that we've got to do so much more to address how we use innovation to serve everyone. So it's got to be both. We have to make sure we don't do this in a way that stifles innovation and undermines this technological process that John and Greg have spoken so persuasively of, but we have to do it in the right way. And that goes to your point about how companies are engaging in this space and what our expectations are from them. I think it's a perfectly valid concern. We sometimes use the phrase of blue washing, where companies align with the UN in a way that makes them look good. But the reality is, the risk here is not so much that companies like Novartis and Microsoft are saying things and not doing them. It is that the vast majority of companies don't even bother to say the right things, much less do the right things. So what we need really is, as I think both Agnes and Nanjira and I have all said, is we need the government to do its role, and governments have a responsibility to regulate companies. If governments are saying that all companies have to conduct mandatory human rights due diligence, then it's both a way to make sure that the human rights leaders, companies like Microsoft and Novartis, are doing what they say they're doing. So it's a check against what they've committed to do, but it's also bringing a level playing field so that all the other companies are trying to do the same thing. So we need the government regulation that will make these practices a requirement, not just an aspiration. And we also need the systems in place within the companies. And we do expect and want more, not just from Microsoft and Novartis, but from all other companies that really not only do the types of things that they're required to do under the UN guiding principles, but also critically the transparency around it. So we see transparency reports now on some of these things, but they don't go deep enough or far enough. And so we need more accountability on that side as well. And we're really looking forward to seeing that. We have a ongoing project in my office that works with tech companies about how they're applying the UN guiding principles. So it works to provide practical guidance. So there are questions about how those tools work in a sector where the end users may be quite distant, and the scale of some of the abuses or problems are difficult to figure out what sort of remedies make sense, for example. So we need that practical guidance for companies, but we also need to do this type of work to make sure that they are held accountable in the ways that you spoke of, Stefan. Thanks.
Thank you. We're sort of getting to the end now of the panel, and I would like the audience to start reflecting on whether you have some questions to the panel, but as well on the Zoom audience or the online audience, there's a Q&A sort of chat section that if there are any questions, please use that. But whilst you are thinking about, probably I would like to pick up on something Greg said at the very beginning, and that's the importance of collaboration. And I would like to sort of get that to Nanjira, and an African proverb that says that, if you want to go fast, go alone. If you want to go far, go together. And I do think that the technology drivers of private sector and big tech, who have a tendency to want to go very fast and a tendency to go alone, really should take heed of that word, proverb that if we really want to go far and long, then we need to go together. And so, from your side, you are a commissioner for tomorrow's report. You are then on the Transform Health that really takes the advocacy forward in the coming years. What are some of the key steps that you feel needs to be done to achieve this? And then I'm opening up to the audience, and I would like to give a little heads up to Flavia Schlegel, who used to be the Assistant Director General of UNESCO and is now with the IDAR, the International AI for Health Research Collaborative, to probably give us quickly a little bit on that data collaborative and input as part of the audience engagement. But over to you, Nanjira.
Sure. And, I was just reflecting now on the fact that usually these kinds of proverbs and human values like empathy come up quite a lot towards the tail end of our panel discussions. And often I think the gravity of what they're calling for is often overlooked. And I think in the tech sector, you find somebody's probably thinking about it as a hack, right? But I think that proverb speaks to a very difficult moment we've been arriving at as a humanity and as a people, on really how the governance institutions we have are fit for purpose. And Peggy brought this up brilliantly. So we still have this paradigm where governments are just sitting back and then regulating when everything has gone south. Private sector have amassed more power than many states now. And how do we deal with that paradigm? And unfortunately, if it still goes on that civil society, I thought, as those people outside with banners. But there's a need now for, very open and will be very difficult conversations that entail different stakeholders and on how we actually govern health futures that leverage digital technologies and artificial intelligence. And here the emphasis again has to be on centering these diverse perspectives and realities of communities and healthcare practitioners in different contexts. It's not just enough for us to sit here and be representing a bunch of stakeholder groups, but we really, really, really need to understand those kinds of contexts to which we're hoping we can serve and even, again, leapfrog what's possible and what's not. And so here with Transform Health, one thing we'll be doing is picking up some of the recommendations from the Lancet Commission that will be launched tomorrow, where again, we re-emphasize some of these values that should guide where we're going with digital data and artificial intelligence for health futures and trying to put them into practice. And one area we've identified and have already started doing work on is on health data governance principles. Now, earlier we talked about the tobacco moment and whether we can get to a convention, and really in the digital age, we have not been able to advance yet at the international level, any kind of convention or binding element for either companies or governments or both. And that's a big question, whether we'll end up in a place where we have binding rules for both companies and governments, because they're the two big players driving how things are happening. But in the meantime, we work on things like principles that we hope that through the process of consulting on them, aligning stakeholders on the core tenets of data governance, to create an environment where all people and communities can share, use, and benefit from health data. And I wish we had more time to go into what that actually means, because it's one thing to say it like that, it's another thing to really unpack what it means to not only be a data provider to a healthcare system as a study case, but how do those benefits come back to you? And again, the vaccine moment has shown us communities that were involved in the test trials have not gotten their vaccines yet in many parts of the world, including my own country. So that is usually a kick in the gut when you still have to speak to these things, because we say them and they sound nice, but in practice, it still remains far from reality. These principles we're doing this consultation with civil society, we're taking our time, we're structuring it to be deliberative and inclusive from as many geographies, demographics as possible. And they'll be targeting governments, developers, and other stakeholders who are collecting health data to eventually be used as a tool to hold all of them accountable to equity and human rights agendas. So, there will be a critical milestone and contribution towards the development of a global framework for health data governance, because I personally feel that in talking about data governance broadly, there's a very unique element around health, because when we talk about data, and Stefan, in an earlier conversation, you pointed it out, it's not just some abstract zeros and ones, it's our bodies. So how we think about governance of health data is really calling upon us to think in a very unique way that's both lateral and vertical, if you will. And I think, this is just one example of how civil society organizations and coalitions are getting involved. But I want to conclude by saying, it's really, really important as we go forward that such approaches are supported, especially by governments and intergovernmental organizations who might be tempted to just reinvent the wheel when they get onto it, on the wagon. These spaces have more flexibility to go to these communities in a way that these current institutions and intergovernmental organizations and governments do not yet operate. So rather than reinvent the wheel, why not come together and use other stakeholder groupings to help advance what we need? And then governments and intergovernmental organizations can focus on seeing whether they can get us a convention on digital age going forward. So let me leave it at that.
Greg, do you want to comment quickly?
Yeah, just a quick comment. I can't help but amplify the comments and on the proverb. As a physician, I must relate. Healthcare runs on trust, and that trust is key. Microsoft or any other company will only have a significant impact in positively transforming healthcare in a deep partnership with those who provide healthcare. And it's why I'm at Microsoft, because their model is, and we talked about data in this governance, is that the data stays with the entities we empower. We insist on that. In fact, we're not a data aggregator. We bring tools, we bring platforms to empower those we partner with to do interesting things with their data, with that model. And that's a model that then empowers that trust. Yeah. It's not a business model based on monetizing individuals' most precious private data, but it's actually insisting that our partners use that data, to make meaningful differences for patients and those they care about. So I just love the proverb, and I love the application of where you're going forward with.
Great, thank you, Greg. We'll turn now to the audience, and Flavia, it's a bit odd if you have questions as an audience, you have to turn yourself towards the camera. We will see you then here on the screen. Yeah, so you need to look at the back there, and then provide your input on IDAR.
Well, thank you very much, Stefan, and also to the panelists for a really inspiring.
Not yet, no, the mic is.
Well, you found it on and then. It's the new, you're on mute.
Nope, the mic doesn't work yet. So whilst we're fixing that mic, or let's see how the mic is working now. The mic handhelds are still not working.
Now?
Yeah, now it's
that's
great.
better now. Well, thank you, Stefan, and thanks to panelists, really inspiring and very timely discussion now. I'm working at IDAR. We're trying to create this global research platform for the digital health and AI. And I mean, what we're struggling with when it comes to data governance, I mean, there is just a question of definition and also terminology. I mean, whose data are we talking about? Who owns that data? Who actually can work with the data? And at the very end, who benefits from whatever we do with the data? Or also, how do we share the risk? And when we talk about trust, I think we had a very good panel also this morning, where it was clear, I mean, when I'm giving data, at some point in time, something should also come back either to me or to my community. And if that doesn't happen, then obviously trust is very difficult. Now at IDAR, I mean, we also see a need to reconcile national capacities. I mean, not all countries have data policy or a digital policy. Most might have some kind of a health policy, but then they're also both usually in sort of like in a silo mode. So we have health policy, but how much interaction, synergies, overlap is with a data or a digital policy, if there is any. And then how to bring together sort of like national aspects and issues of sovereignty, data, security, then with the global need and demand as we see now during the pandemic, where obviously would like to openly share all kinds of data. But then again, I mean, there are very different situations, and how do you reconcile what is the challenge for the organization like the WHO, bringing together all the diversity of the context, political, economic systems where we are sharing the data for a benefit which might not actually be globally now defined. When we see this now with the vaccine, I mean, everybody says, yes, everybody should be vaccinated, but not everybody is really working and putting all the energy that the vaccines are going out to everybody. Maybe just one last comment, since we're trying to create here a research platform, there are also issues for the science ecosystem. I mean, scientists and researchers probably have to adapt to the situation as well. And it's not only when we're talking about now about human rights that the science, which usually should be neutral and independent, which I think is very difficult when we look at the challenges ahead of us. So what kind of research are the funding organization actually funding? Should research really be independent and neutral, or should it actually turn towards a global public good? So is for the science, is the question that we should not harm human rights, or should the human rights be the base of how we conduct science and how we conduct research? And I think also there we need quite a turnaround also within the science community. And there again, whether we can make sure that, and that's what IDER is trying to do, that we have some kind of global norms and standards on how science, data science, a science with big data should be conducted. I think this is going to be a topic for 1 or 2 more World Health Summits. And I think we're probably all grateful in the audience here that we can have panels like this one. So thanks to the organizers. And please join IDER Tuesday afternoon at PD 27. So you will know more about what IDER is doing. Thanks a lot.
Thank you very much. Do we have other inputs, questions from the audience here? Otherwise, I'll pick now what Flavia said in terms of the importance of benefit sharing, given that we, have data that's from all of us, from communities, and how can we make sure on this data, derived benefit sharing? It would be good to hear from John and probably Greg very quickly, but as well from Agnes. Maybe you want to come in a bit on that tension between, is science really neutral as it refers to human rights, which is that tension, or is science happening within a framework of societal narrative that's very much, having its own sort of understanding and how we apply human rights within science and research. And Peggy,
that's a simple question.
Good. Let's hear first from John and Greg, and then we get your simple answer.
Thanks a lot, Stefan. I can't agree more. I think the appreciation is a key topic here when it comes to data sharing and the use of data. And we at Novartis are working on our data ethics principle, where we put appreciation as the center of everything whenever it comes to us working with any form of data. How we are going to realize that, it's still being discussed and being debated, but we see it in 3 different ways, because this is not something coming from us. It's actually coming from the patients advocacy groups and the patients that we are working with, that they would like to see more transparency as well as appreciation whenever they share that data with us. And therefore, we think one of the areas they're mentioning is we could show the appreciation by just education. Because we spend a lot of time here talking about data governance and all these things. But I can tell you, majority of the people who provide us with this data may not be able to understand all these words that we are using. So how do we put our ask for data whenever we are using their data in a way that they can understand, in a way that they can educated, in a way that they can see the value this is bringing to themselves and the society? In essence, that can be an appreciation itself to ensure that we educate them, we educate the society, we educate everyone who is involved in sharing this data to understand the value it is going to bring to the society. So I fully agree that this is an area that we are going to work on, and it's an area that we think we should be doing more around as an organization, that we show this the level of appreciation that is expected to the people who bestow and trust us with their data, because actually without that, it will be very hard to build this trust with the society as one of our key pillars of the organization.
Great. Greg, benefit sharing.
I would just say really important that we actually enable the ability to share. And it's why we've leaned into open access platforms like Terra to allow open source platforms to allow sharing of public access data sets, as well as controlled access data sets with all the governance and security and privacy. So it's really development of platforms that enable the biomedical research community to actually share data within privacy and security constraints. It's why we lean into supporting things like the sovereign cloud to allow that framework in local and regional context as well. So it's so important to enable not only those platforms to provide a way to facilitate that sharing, but also to be sure those platforms support international data standards for interoperability, like the FHIR standard, and to allow equitable, fair, and frankly, much easier access for researchers that need this data to use it for their studies, to really accelerate that. Healthcare data is siloed, and standards, and international standards, not local standards, really are the answer to that, we believe.
Thank you, Greg. We are towards the end. We only have 4 minutes left, and I would like to give the sort of a closing statement to each one of us here on the panel. And you need to keep it at 30 seconds. So I start with Peggy. And sort of, what is your most urgent call to action in 30 seconds linked to human rights and AI in health?
30 seconds. I think I want to bring us back to the digital divide, because there was a bit of a back and forth on how that plays out. And I think what it showed is that we have to be smart when we talk about the digital divide. It's not just between countries. It's not just within countries. We have to look at who gets left behind by the digital divide. And it's absolutely clear that women face greater challenges. Older people, who we haven't mentioned at all, face greater challenges. And then the poor and the marginalized in every society. So in other words, if we want to make sure that digital use doesn't exacerbate existing inequalities, we have to be smart about how we address the digital divide. Thanks.
Great. Nanjira, 30 seconds, and I'm actually timing it.
I mean, much has been said. I think I just want to probably, another group we've not talked about is young people, whose agency and really, you know, the fact that they're inheriting an earth that has this existential crises at the moment, they have something to tell us about how we understand this. And I speak to this specifically towards whoever is sitting at the helm of a governing institution. You risk not making any contribution to the world if you're not centering the perspectives of young people all over the world.
That was actually on the dot, 30 seconds. Now let's go to John, and then Greg, and then the last 30 seconds is for Agnes.
Thank you very much. So I think Novartis is committed to the ethical and responsible use of artificial intelligence. And we see that AI brings opportunities and challenges, and we want to address this thoughtfully and affirmatively. And we are looking at a collaboration and working together with everyone, including NGOs, non-governmental organizations, and regulators, to ensure that we do this thoroughly and correctly.
Great. You had 9 seconds left. Greg, you can have the 9 seconds from John.
Thanks, Stefan. I believe the future of healthcare should be built by many and accessed by all. So my call to action, whether you're a technologist in the private sector, a policymaker in government, a citizen, is is to come together, work together to remove those barriers so we can create access to healthcare services for the 4 billion people on the planet that today and tomorrow have no meaningful access.
Fantastic. And I have got a great panel. They really stay in time. Agnes, the last part is for you.
Supporting everything that has been said and calling on everyone involved to ensure that the way we proceed is fully aware of how digital health, artificial intelligence is used to control people or may be used to control people, how artificial intelligence may be used for the purpose of power, for the purpose of military power, i.e. getting into the brain of soldiers, as it is being done at the moment, how digital health is solely driven or could be solely driven by profit, and where do we place profit in our scientific inquiries? Where do we put a limit to profit? Where do we say stop, profit should not overtake and should not be the sole driver? Where do we put limit to surveillance and to exponential surveillance of people around the world? I will say power, profit, surveillance should be the 3 issues that I will call upon all of us to focus on as we move forward. Thank you.
Thank you very much, Agnes, and thank you the entire panel and the audience for being with us this afternoon. What I really encourage all of you, that's my call to action, carry on that debate in all your companies, in your universities, in your town halls, around the dinner tables, lunch tables, sitting picnic in the grass. This needs to happen everywhere, this conversation. We cannot leave it to some others somewhere out there. It is about us. Thank you so much, and wishing you a good rest of the Sunday and a wonderful World Health Summit. Thank you.